PCMH, or the patient-centered medical home, really drives home the point that it is incredibly important to maintain health, and if the patient has disease, to minimize that and to prevent it from worsening.
It means that we collaborate with our patients so that they can reach their health and wellness goals. As an osteopathic family physician, we are trained to consider the mind, the body, and the spirit of the patient. We try to develop personalized care plans so that our patients can reach their goals for health and wellness. We also provide extra access for same-day appointments. We have a portal, internet web portal for our patients to access parts of their chart and to interact with us when our office isn't even open.
Another factor or facet is that we're collaborators with our patients, and we see ourselves as helping patients not direct their treatment, but shape their treatment.
Behavioral health is an integral part of a patient's well-being. You can't really treat a chronic illness like diabetes and hypertension without addressing the patient's behavioral health.
There are so many patients who have problems with anxiety, depression, stress, relationships, and because we have that resource in the center for them, it improves their overall care that we can address those issues also.
Physicians can work closely with psychology and get information immediately if they have a patient that needs care, and most importantly, an appointment if needed.
Research has shown how factors like depression and anxiety and stress can have detrimental effects on a patient's overall health. Our role is to help patients embrace and identify those specific behaviors that are going to improve their health over the lifespan.
When families come to me, they're asking for help. So being able to offer them psychologists or behavioral health services that I'm not able to provide myself, it's really rewarding for families.
We have a social responsibility to the communities in which our healthcare centers are located to raise awareness around critical health concerns, preventive screenings for cancer and other diseases, getting immunizations. And one of our hopes in the coming years with the support of Independence Blue Cross Foundation is to begin programs that focus on more health education.
It's giving the patients more time to open up about their personal issues. They have more group discussions, and that way they're able to meet other patients that are going through the same thing that they're going through. And not only are they getting tips from the behavioral health specialist, they're also getting tips from other patients.
The doctors are here, they're more interested in the patient. You're not in 2 minutes and out the next 2 minutes. They take time with their patients and they listen. Like, I want a doctor to treat me like if he would treat his own family. And that's what I get when I come to PCOM.
You know, I think what's so unique about what we try to do in our healthcare centers is we're not just delivering good medical care. That's really important, of course. But we have to develop good relationships with our patients. And that's one of the things that's the secret to this.
As a primary care physician, as a therapist, you have to like what you do. We are people who care about other people, and so we want what's best for them. And I think that we all have a calling.
A lot of times you walk into doctors' practices and you walk in and you're kind of seen as a number. It's kind of like a get them in, get them out. But here I've seen the providers actually, even if it takes an extra 15 minutes and backs them up on their schedule, they'll take that 15 minutes.
When you have a team with the primary care, they're all working on the same project. Everybody knows what everyone is doing. And so the patient doesn't fall through the cracks.
In today's world where everything is rush, I don't feel like that at PCOM. I feel like people generally care for my healthcare needs and for me as an individual.